Sir, we can go live now, sir. Facebook is live, sir.
My dear friends, National President IDA, Dr. Ravinder Singh, President ICD Section 6, Dr. R.P. Gupta, Honorary Secretary General IDA, Dr. Ashok Doble, Office Bearers of the IDA Head Office, State branches and local branches, members of the Board of Regents of ICD Section 6, heads of the various dental institutions from all over India, members of IDA and fellow of ICD, faculty and students of various dental colleges, I welcome you all to this program under the webinar series Extra Innings. The series is a joint effort of ICD, IDA and GSL Dental College Rajamundry to bring you some new topics for discussion every time. Dear colleagues, we all have been through a very turbulent period in our family, social and professional lives in the last 1.5 years. I appreciate the efforts put in by all of you to emerge from this challenging situation very bravely. I know that some of us have lost our family members and co-professionals in this pandemic. My sincere, heartfelt condolences to the bereaved families and pay my homage to the Corona warriors. It's thanks to these sacrifices that we are today hoping that the difficult period should be over soon. These next 3 months are crucial for all of us, and we need to follow all the advocated protocols strictly. You will all agree that it is not easy to set up a dental practice today, especially after the COVID pandemic. There are now hordes of permissions, requirements which you need to complete before you establish the dental practice. My concern is beyond procuring your equipments, materials, and instruments. You have to deal with so many agencies procuring various permissions before you are fully functional. Today, we have among us two very accomplished speakers to share their experiences and guide us about the various protocols which need to be implemented before you set up your dental practices. They both have excelled beyond their professional education and are helping the IDA and our professional colleagues to set up flourishing practices by guiding them and helping them to overcome the hurdles to achieve the success. I present to you Dr. Charubala Pavan and Dr. Kumar Rajan. Let me first have the honor of introducing Dr. Charubala Pavan. Dr. Charubala Pavan has an experience of 21 years as a dental surgeon and 9 years as a quality professional for NABH and QCI, technical consultant to Indian Dental Association Head Office Mumbai for the upcoming accreditation program. She is a Bachelor of Dental Surgery for Government Dental College Mumbai. She is PG Diploma in Hospital and Healthcare Management and in Clinical Research. She is postgraduate in Public Health, trained as internal counselor on implementation of NABH hospital standards, trained as NABH dental assessor. She has been faculty for several training programs of NABH and is a technical committee member of NABH dental standards since 2017. She is a principal assessor for NABH audits for dental colleges, hospitals, and dental clinics. She is also QCI assessor for ECHS and CGHS empanelment. She is technical consultant to head office for developing quality standards for upcoming accreditation program for dental facilities all over India. She is also active in IDA, being the joint secretary of IDA Jamshedpur branch, and she also has training, and she is a specialist in tobacco intervention for IDA head office for counseling and oral cancer screening. She is a fellow of International College of Dentists, India, Sri Lanka, and Nepal section. I'll also like to talk about our second speaker, Dr. Kumar Rajan. He's a well-known speaker in the dental professional circles. Dr. Kumar Rajan is a health, quality, and development professional with education in oral health management and development disciplines. In his 21 years of professional career, he has worked at WHO, Directorate General of Health Services, Ministry of Health and Family Welfare, NABH, All India Institute of Medical Sciences, and Safdarjung Hospital, and Indian Dental Association. Presently, Dr. Kumar is National Technical Advisor of IDA and is also a Fellow of International College of Dentists, India, Sri Lanka, and Nepal section. I'll invite our first speaker, Dr. Charubala Pavan, to start the program for today. Over to you, Dr. Pavan.
A very good evening to all my senior colleagues, friends, and all those gathered today. It gives me immense pleasure to be a part of this gathering today and share whatever little I know. Dr. Chugh sir has been very kind in introducing me, and I hope I live up to all your expectations. So without wasting much time, I would like to start today. I would like to start my screen sharing. Is that okay, Dr. Hari? Can I start?
Yes, ma'am. Yes, ma'am.
Yeah.
You can start.
So today's topic is a very interesting one, which says things you cannot miss before starting dental practice. Sir has already introduced me, so I will not go much into the details of who I am. My name is Dr. Charubala, and that's enough, I think, for now. So today's topic is rules and regulations for dental practice in India. When we look at the professional life cycle of a dentist, we see that, we have various colleagues, starting from those who've started new practice, those who've established practice, and those who are in a career transition towards retirement. When we set up our new practice, we focus on team building. We want to employ various consultants, endodontists, oral surgeons, orthodontists, and many others. Also, we also want to have good paradental staff, dental hygienists, dental chairside assistants, dental mechanics. We need to have, good dental laboratories to provide us services. So we are busy with that aspect of developing our practice. After about 10 or 15 years of practice, when we are established, we enter into a different phase where our focus is on process management. We have patients, we have infrastructure, we have our machines, but how do we manage all of that? That takes a lot of our effort, and sometimes we face day-to-day challenges like, material stockouts, keeping up with our legal requirements, keeping up with consent forms. So these become a problem. When we approach the next stage of our career, we have, we transition into either we could sell our practice, or maybe some people hand it over to their children. So these are various phases of professional life cycle of a dentist. Before I begin my topic for today, I'd like to talk a little bit about a Japanese technique called Kaizen. Japan in 1945 was a completely devastated country. India got independence in 1947. So more or less at the same time, we had to build our nation. But today, Japan is where Japan is and India is where India is. The reason is that Japan followed a very interesting technique called Kaizen, which meant incremental improvements. We make small changes in our life every day, and slowly we build up to reach a level of quality. So if we implement that in our day-to-day practice, whether we are new practitioners or whether we have established practices or whether we are transitioning into sale of our practice, it helps us. So similarly, when we talk about legal requirements, when we start a new practice, there are several regulations and acts we need to know about. But this continues as we establish practice because laws keep changing, new laws keep coming, and we have to be a part of the system. Following that, even if we have to sell our practice tomorrow, we need to know whether all our legal liabilities have been fulfilled. Otherwise, it would be difficult to sell our practice. So I start with our first legal requirement. I would suggest that everybody go to DCI website and read the very basic Dentists Act of 1948. Dentists Act has come to many amendments, once in 1992, 1993, 2016, and we have a newly tabled bill of Dentists Amendment Act for 2019, which has not yet come as an act, but it's billed right now. So when we talk about the Dentists Act, what are the various things we need to know? We start with registration with State Dental Council. Registration, as we all know, has two parts, Part A and Part B. As dental surgeons, we come under Part A. Part B was primarily made for those displaced people who suffered the horrors of partition, those who were from Bangladesh, from Pakistan, who moved into India and did not have their degree certificates and qualifications, etc. But it has to be noted that from 1971, there have been no new registrations in Part B. So this new amendment of 2019 speaks about removing Part B as a representation for various committees in DCI. Anyway, as dentists, we are basically concerned with Part A. So we have to register ourselves in Part A. Our registration includes our full name, our nationality, our address, when we first registered ourselves, what was our date of degree, etc. When we get additional qualifications, like suppose we get an MDS, then we have to add that on to our original registration. Now, why this registration is very important is that we have to display the registration number on all our prescription pads, on all our certificates, all our money receipts. So when we start our practice, when we have a prescription pad, we have to remember to put our registration number on our prescription pads and money receipts. Dental surgeons, as dental surgeons, we have to display only those suffixes which are recognized by the Dental Council. We can't put any other false qualification which will give a wrong impression about our dental knowledge. We can't put abbreviations of memberships like member of IDA. Many people put MIDA. That should not be displayed because that is not our degree. The renewal of registration in most states is an annual sort from 1st of January to 31st of March. Some states renew for multiple years, like the state of Punjab. They give 5-year registrations, which has to be renewed after 5 years. Now, if we have registered in a certain state, if we have studied in a certain state, and we decide to practice elsewhere in a different state, you can ask for a no objection certificate from DCI, and you can change your registration to the state in which you are practicing. Similarly, there is registration for dental hygienists and dental mechanics in the state in which they reside, and their qualifications have to be registered. So when we talk about the Dental Code of Ethics, I'm going to briefly touch on some important salient features which we need to know when we are setting up practice. First thing is, how do we name our dental establishments? Do we call ourselves a clinic? Do we call ourselves a hospital? So there are specific guidelines for this. We can call ourselves a hospital only if our practice involves the surgical treatment under general anesthesia or local anesthesia and requires the patients to be maintained as inpatients. If you don't have inpatients, you should name yourselves as dental clinics. The reason why this distinction is made is several laws have to be fulfilled for hospitals which are different than those which are fulfilled for dental clinics. For example, the Clinical Establishment Act has a separate section for hospitals and separate one for dental clinics. Second thing is, all of us, when we start practice, we want to advertise ourselves. We are today in a global world where brands are important, where unless we advertise ourselves, people feel that they are not going to be known and well known enough for patients to come. But there are some rules for ethical advertisements. First, I'm going to talk about those things which are not ethical, and then we'll come to how do you actually advertise yourself. So if you solicit yourself, many times we see auto rickshaws with, signboards saying so-and-so dental clinic. That is actually bad solicitation. Also, cold targeting of vulnerable groups and promotional activities are actually unethical advertisements. Many times, these chains, corporate chains of dental clinics, they have very unethical ways of advertising their clinics. One example was My Dentist. This was a very large chain of dental clinics, and there were numerous complaints about unethical advertisement against this clinic. This clinic had 106 clinics in Mumbai, Pune, Ahmedabad, Surat, Mangalore. So the Maharashtra State Dental Council and Karnataka State Dental Council sent the clinic a notice. So why were they, why were they sent a notice? Because they used to have advertisements on buses. They used to have advertisements which used to offer free vouchers and free coupons. These are unethical ways of advertisements. So when the notice was served to these corporate chains, that meant that all the dentists who were working in these corporate chains would face disciplinary action by Dental Council of India. This is a very important issue because if you are going to be working in a chain, you are liable for what practices they follow. So these are some things which you should not be doing. You cannot employ an agent or a canvasser. Like I said, there were things on auto rickshaws, which is not done. You can't exhibit a disproportionately large sign. There are certain rules for every municipality as to how big your sign should be, how far it should be from your main road, whether you can have, what kind of wordings you could use, what should be the size of the wordings. That has to be followed according to the local laws. Also, you cannot use a dental surgeon's name for commercial articles like toothpastes and toothbrushes and mouthwashes, etc. You cannot write your opinion on any procedure or any equipment with your name. You cannot have surrogate advertisements. This happens sometimes. You see a TV serial and in the background, you could see XYZ dental clinic or XYZ hospital. So these are surrogate advertisements, which should again not be allowed. To advertise in electronic media like TV programs that display names, addresses with scrollers of clinics, again, these are unethical. So how do you actually ethically advertise? You ethically advertise when you can advertise when you start a practice, when you change your type of practice. Suppose you were a general dentist with general dentistry as a practice, and you move on to specializational practice. Like, for example, suppose your clinic has moved on to, say, only endodontic treatment, then you could advertise. If you're changing your address to a different part of the city or state, you could advertise. If you are on a temporary absence from duty for a prolonged period of time, if you're going on leave, you can advertise. You can advertise when you come back from a long period of break. Some women take maternity leave for some time. They close their clinics for a short while and they resume after they feel it's possible. So you can advertise when you resume. On succeeding to another practice, when you move to another practice, again, you can advertise. Suppose you've bought new equipment or new services you're offering in your clinic, but you couldn't have boastful claims like being the best or the first, especially if there are already such services which are available and other facilities. Through maintenance of websites, this is something which you can do. You can have websites because websites are good. Websites give patients ideas and informations which are factual. You can carry your feelers there, your service is available, and this helps the patient to make an informed choice through a transparent system. But again, websites should not make claims or statements that are not factual or misleading to the public. So all these points which I have taken about dental ethics and about advertisement, these are actually taken from the website of DCI. I would request all of you to go through this once. When we talk about patents, a dental surgeon can patent instruments and appliances. Supposing you have invented a new type of implant, then you can apply for a patent. But your patent will not be ethical if you cannot use it for greater interests of your population. In the sense that, supposing for the greater interest of your population, the government wants to use your surgical instrument or appliance for a larger amount of population, then you have to share it with them. Then regulations on prescribing and dispensing drugs. This is something which many new dentists do ask me, whether you're allowed to sell medicines in your clinic, because they think it's a small way of making a small amount of profit, that they buy it at wholesale rates and sell it at retail rates. So can you do it as a dental surgeon? The answer to that is you cannot run an open shop. You can dispense those prescriptions which you are prescribing. That is allowed. Or supposing you have a surgical appliance, supposing you're putting an implant in a patient, you can sell your implant at whatever price it is. That is allowed. But you are not allowed to run a shop unless you have a separate pharmacy for it with a pharmacy license, a drug license, etc. About medical records, we need to know how long we need to maintain medical records. So there are some laws on this about medical records. We have to maintain OPD records for a minimum of 3 years from the date of commencement of treatment. So there are some exceptions to this. Suppose you are treating a minor patient, for example, supposing you're having orthodontic patients, then you have to maintain the casts and records till the patient becomes a major. If you are involved in any medical legal cases, then you have to maintain the records till the case is going on in court, or 10 years, whichever is longer. If somebody makes a request for authorizing medical or dental records, you should be able to give it within 72 hours. So this was one memorandum, I don't know if it is clear, which was given by the Government of India, Ministry of Health and Family Welfare, DGHS, which said that IPD patients, case sheets, etc., in hard copy should be kept for 3 years. OPD again in hard copy for 3 years. Medical legal cases and case sheets for 10 years or till the ongoing cases and the courts have decided these cases. And if you're talking about digitalized form, then you should keep all future records in the digital form in a continuous basis indefinitely for future reference. But hard copies should be preserved for 3 years. A registered dental practitioner should maintain all records of medical certificates. Many times you will have people who come to your practice who want to apply for Merchant Navy or some other organization which asks for a dental certificate, in which case you'll do the examination and you will give them a certificate. But when you are issuing the certificate, you should have a copy of the certificate and some identification mark of the patient should be there. For example, a thumbprint should be there on the certificate. So there is an appendix 2, which is given in a revised code of dental ethics, again in DCI website, in which they show you how to prepare a dental certificate or medical certificate to give a patient who comes to your practice. So this is a useful bit of information which you can see from their website. So again, the next point for this thing of ethics of 3.3.4 is that efforts should be made to digitalize all dental medical records for quick retrieval. Next, we come to the transparency of fees. Before you start your treatment, the fees should be announced to the patient and not after the treatment is underway. Remuneration which is received should be in the form and amount specifically told to the patient at the time the service is rendered. If you're going to have a change in treatment, that happens at times. You start doing a procedure, you encounter a complication and you decide to change your modality of treatment. Then when the change is going to happen, you have to inform the patient of the change in the charges which he is going to incur. Also, it is a good practice to have an informed consent form, which includes not only the treatment which is going to be provided, but also the complications and the risks which the treatment can incur. So when you get the patient to read that and sign it, he is aware of the fact that there could be a complication, in which case there could be a change in treatment outcome and the type of treatment you would be rendering, and hence the fees could be different. So that was all about our DCI registration and their website and all their points which are given in the website. I have taken it from the site and put it down into smaller points so that it's easier to understand. The second thing is, fine, we have registered ourselves, we have understood what are the requirements by DCI. So now we go to get ourselves a clinic. So either we buy the clinic or we enter into a leave-in license agreement, or we could enter into a partnership agreement. So what are the documents you need to have? According to law, you need to have your documents of ownership with the latest property tax receipt. You need to have your documents of leave-in license, which has to be renewed, and these should be registered documents. You could have a partnership deed, but again, it should be a registered document. So the next law which you have to deal with is registration with your district health authority or your CMO or your municipality. So to just give an idea, I've just taken the districts which are present in Andhra Pradesh state. So depending on which district you belong to, it is a good practice to have a look at your district map so that you get an idea of where you live and what are your laws in that particular district. So you should register with the state district authorities. For example, registration with Andhra Pradesh Allopathic Private Medical Care Establishments, Rules 2007. That is what they follow in Andhra Pradesh state. So in Andhra Pradesh state, again, I've just taken it from their website. When you go for registration to your district authority, these are the various documents you require to fill along with your application form. You have to fill a criteria of infrastructure, of their essential medical equipment, which is stated by them, equipment for protection from radiation, facility for disposal of biomedical waste, effective maintenance of sanitation, hygienic standards, infection control. You should have qualified doctors, which you should list your staff. You should have qualified paramedical staff. You have other essential staff, and whatever other audit reports are required. All these things have to be filled in duplicate while applying for registration with district authorities. Once you get the registration certificate, it has to be displayed prominently at the reception or at the entrance of the establishment. This is an example. Once I had gone for an assessment in the state of Andhra Pradesh. So this was how their district authority registration looked like. This, I have blocked out the names of the place of the clinics and the people, but this is just to get an idea. This was from Guntur, and how it looked was something like this. This is another one. This is a municipal registration. This was for Corporation of Chennai, Public Health Department. So this was how their registration certificate looked. These registration certificates have to be put at the reception of your clinic. Some states mandate registration of private dental clinics, nursing homes, and hospitals under Shop and Establishment Act. Now, what happens is health is a state subject. And because of that, different states have different requirements, and you have to check what is valid for the state in which you are going to practice. Suppose that mandates Shop and Establishment Act, you have to register under that. This is an example of registration with Shop and Establishment Act. This was with the Labor Department in Chandigarh. This was a clinic in Chandigarh, and this was how they had registered. The clinic, was in Karnal. The registration of the Labor Department was in Chandigarh. Now, this was another clinic which was in Hyderabad, and they had registered for GST. So this brings us to an interesting question. Are we exempted from GST? So now, according to notification number 9/2017, it has exempted healthcare services. That means it exempts healthcare services by a clinical establishment or authorized medical practitioner or paramedics. So what does this actually mean? Are we required to register under GST, or do we not register under GST? So there are certain laws for this. The first point is that GST requires registration on the basis of turnover. It provides a threshold turnover exemption of 20 lakhs. Supposing your turnover is less than 20 lakhs, you do not have to register for GST. So how do you determine your turnover? So again, there are certain things which are exempt and certain income which is non-exempt. So when you are engaged only in healthcare services, you're only providing dental treatment and dental services, then you are exempted from GST. But supposing you are engaged in something, you are engaged with other practices which give you other sources of income, then you have to calculate whether you need to register for GST. So let's give an example. Supposing there is a doctor who is practicing in a hospital. He has a turnover of 18 lakhs from that hospital. And he also sells educational videos online. He makes YouTube videos or educational videos, and he sells them and he has a turnover of 7 lakhs for that. So here, while the turnover from the practice is 18 lakhs, in order to determine whether GST registration is required, one needs to see the total turnover, that is turnover from practice plus turnover from educational videos, which in this case is 25 lakhs. So GST registration would be required in this case. So the next rule we come to is electricity meter rule. So how do you calculate what what kind of meter you apply for. So what you need to do is, first you need to add up the kilowattage of all the appliances which are going to be used in your dental facility. And you decide what is the consumption requirement. According to the consumption requirement, you will apply for your meter. Now again, because health is a state subject, there are different tariff rules for different states. I'll give you a couple of examples. In the state of Maharashtra, there was a decision which was given by Bombay High Court in 2011. This said that in respect of the premises which are used by professionals like lawyers and doctors for their own residence, the tariff of electricity supplied to the premises would be charged on the basis of domestic use, irrespective of whether the premises are used for the whole or for part of a day for purpose of carrying out professional activities. What does this mean? This means that suppose you have your clinic in your residence in Maharashtra, you will have to pay electricity bill based on domestic tariff. This was for the state of Maharashtra. But if you look at the state of the example of Uttar Pradesh state, they have a different rule. They say that up to 50 square meters, that is 540 square feet of residential space can be used by dental clinics, doctors, lawyers, and other professionals for professional activity and will incur domestic tariff. This means if your clinic is bigger than 540 square feet, you will incur commercial tariff. If your clinic is smaller than 540 square feet, which is in your residence, you will incur domestic tariff. So depending on the state, you have to figure out where you fall regarding electricity bills. Next thing we come to is fire laws. According to National Building Code Part 4, buildings which are above 15 meters in height need clearance and NOC from the Chief Fire Officer. So to get an idea, 15 meters is approximately 4-story. So supposing your building is a building which is greater than 4 stories in height, it will probably be above 15 meters, in which case you need clearance and no objection certificate from the Chief Fire Officer. So this is a small checklist which is given for what you need to see. This is given on NABH website. So this is basically for hospitals, but just to give an idea, first point in the checklist is you have to see if you have sufficient firefighting equipment. Second thing is whether you have a maintenance plan for the firefighting equipment. For example, supposing you have a clinic, you call a fire engineering firm and they tell you that you need ABC type of fire extinguisher, you need a smoke screen or a smoke detector, you need a fire alarm, and you install all these things in your premises. You have to have a regular maintenance and operational plan for these. You have to have up-to-date fire drawings. You have to have drawings or plans, and they should specify the locations of the firefighting equipment. Also, if your practice is a multi-story practice, you have to have smoke detectors on all floors, which have to be tested regularly. You could have a centralized fire alarm system. This is for hospitals. If you have a big hospital, you could have a centralized alarm system, which is installed in a location, and that alarm is staffed 24/7. You have to have a specific fire exit for each floor. Suppose it's a multi-story practice. And the fire exit signage should be there on all floors. This fire exit signage should be self-glowing or well illuminated. What happens many times is that there is a power outage when there is a fire. So when there is a power outage, it's completely dark. So your patients, your staff need to know how to go out and escape from the fire. So at that time, this fire exit signage should glow. That is according to National Building Code. Your emergency illumination system should come in place, and there should be a designated place which everybody should know about, that you need to take all your patients out of this exit, and you should do fire drill so that staff is aware about it, that all patients have to be taken to safety from this exit and they should all assemble in this particular place. So you need to have mock drills for this so that your staff is also trained in this. This is just a basic way in which you use a fire extinguisher. You pull the pin, you aim at the base of the fire, which is about 8 to 10 feet away. Then you squeeze the trigger of your fire extinguisher and you move it from side to side. So this is called a pass rule for using a fire extinguisher. This is another thing You have to train your staff about it. It's not enough to have a fire extinguisher. You have to train them how to use it. So these are some basic rules which are given. What do you do in case of fire? You remove the patient out. First priority is to move your patients out. Second priority is to call up the fire station and tell them that you're having a fire. Third priority is to close all the doors and windows to isolate the fire. And the fourth priority is to extinguish the fire. You don't want it to spread. You want to isolate it, and then you want to extinguish it. So this is an example of a clinic in Pune which had a third party. This is called a fire engineering firm. So this was a small clinic. Their clinic was not in a premise which was more than 15 meters of height. So what they did was they called a fire engineering firm. There was no need of a no objection certificate from chief fire officer. So they called a fire engineering firm. They did an audit with them. The fire engineering firm recommended 2 fire extinguishers of this capacity, 4 kilogram capacity, to be installed in their place. They checked the fire extinguisher. They trained their staff and they went. So this is one way of doing it. The next law is Pollution Control Board law. So you have to get authorization from your state pollution control board. Each state has got a separate pollution control board. This is for the state of Andhra Pradesh. So in the state of Andhra Pradesh, they have, red zone and orange zone. If your practice is, you have more waste generation, which is more than 100 KLD, and you have an incinerator, you will be regarded as red zone. If your waste generation is less than 100 KLD and you don't have an incinerator, you will be considered in orange zone category. So as dental clinics, almost everyone comes under orange zone category. So you have to apply for exemption for your pollution control board under orange zone category. This is again an example of a clinic in Guntur which had biomedical waste authorization from the pollution control board. And this was a waste they were allowed to, have so much of red, yellow, white, blue. And this would be given by the pollution control board. And there is a validity date given below. So this was the validity date which was given. So this is another example. This is a website of Goa State Pollution Control Board. So in Goa, they don't have a common biomedical waste treatment and disposal facility. They have a couple of hospitals which have incinerators, like for example, Manipal is there, and they have a government hospital. So their incinerators take care of bigger centers. So they have a rule like this, that if you are a smaller clinic, you are allowed to dispose of your waste within your premises with deep burial or encapsulation until there is a common biomedical waste treatment facility. But if you are a larger hospital, they have a tie-up with government hospital as well as with Manipal. So you are supposed to send your waste there. So 6 hospitals were issued notices in 2021. This is in the month of January. They were issued hospitals that they were issued notices that they were not sending their waste over to Goa Medical College and Hospital and Manipal Hospital. So it is not that you can just dump your waste anywhere. You have to be very careful about what are the rules and regulations in your state and how you're following them. So if you go to, the Ministry of Environment, Forest and Climate Change website, you can see the biomedical waste laws in 2016. It is very clearly mentioned over there about what are the kinds of waste to which this law does not apply. For example, you have e-waste, electronic waste. That doesn't come as under a part of biomedical waste law. Supposing you have an old Apex locator, you can't throw it, with your BMW waste. Similarly, radioactive waste, hazardous chemicals, solid waste, which is other than biomedical waste, lead acid batteries, e-waste, hazardous microorganisms, which are genetically engineered. All these things, they come under different laws. So their disposal will be different. So that is the first part where the BMW law does not apply. Second thing is, what is your duty as an occupier? You have to see to it that your waste is segregated at source. Every website of your state pollution control board will give you the exact way in which you have to segregate your waste. What goes into yellow, what goes into white, what goes into blue, what goes into red, all that is given in their website. So it is your responsibility to segregate the waste. You have to store the waste till it is collected, and you have to pre-treat. If you have a laboratory, you have to pre-treat the lab waste, blood samples, bags, microbiological waste before you send it to the biomedical waste plant. Third important thing is you have to provide training to your healthcare workers. All the people who are working in your clinic, your dental assistants, etc., have to be trained on how to handle biomedical waste. Also, all the dental assistants and healthcare workers in your clinic should be immunized for hepatitis B and for tetanus. This is the law. You have to establish a barcode system. Usually in most states, the biomedical waste agency, which comes to collect your waste from the clinic, they have this barcode system machine by which they will provide barcodes. The reason for that is there is a GPS to see where your waste is taken so that they can track it. Also, you have to segregate liquid chemical waste at source. You have to provide personal protective equipment to your staff who are handling the biomedical waste. Your housekeeping staff has to have heavy duty gloves. You have to have non-permeable shoes when they are handling biomedical waste. They have to have goggles, protective face shields, so that they are safe. You also have to maintain a biomedical waste register and a monthly record, and annual records have to be retained for 5 years. These are all the laws which are given in the website. Also, if there are accidents which are related to biomedical waste, you have to inform it and report it. And if your operator is not coming regularly to collect the biomedical waste, you have to inform the authorities. So these are some labels again, which are given in the website. You have this biohazard symbol, cytotoxic hazard symbol. So these have to be used as labels for your biomedical waste containers or bins. So these are some other small annexures which are given in their website. This is a label for transporting the biomedical waste bags. These are the forms which are available in their website. If you have an accident, if you want to renew your authorization, if you have authorization certification format, how you write your annual reports, how you will appeal if the operator is not coming regularly. So all these things, these forms are available in your BMW website. This is an example again of a clinic in Maharashtra where they had a memorandum of understanding, that is MOU, with a biomedical waste collection agency. So this kind of MOU has to be made with your waste collection agency. And for every clinic, you have to do it according to your state. The next law we come to is AERB, or Atomic Energy Regulatory Board. Even big hospitals like Safdarjung was issued a notice because they had not renewed AERB for their radiotherapy department. So they had to shut it down because AERB came for an audit. So we have two types of AERB certifications. One is when we buy an X-ray machine, the manufacturer of the X-ray machine gets a type approval from AERB. The second type of certification you have is an authorization which is given by AERB to your clinic to operate your X-ray machine. This is called ELORA. ELORA is Electronic Licensing of Radiation Applications. So you have to have both these things. One is your manufacturer will give you a type approval which he had taken while manufacturing your equipment, and you have to have an authorization to run that equipment, to operate that equipment in your clinic. So these are the regulatory requirements for dental radiology practice. You do need institutional registration, that is, you need ELORA. Now, X-ray machines can be those which are manufactured in India, or you could have imported X-ray machines. There is a slight difference in the way we do it. You have to take a procurement permission from AERB if you are using an imported X-ray machine. But if you have an indigenous X-ray machine, which is from India, you don't require a procurement permission. A TLD badge is recommended, but it's not mandatory for IOPA X-ray machines. That is for your RVGs and handheld X-rays and wall-mounted X-ray machines. It is not needed, but it is recommended. And if you have an OPG machine or a CBCT machine, it is definitely required. Your registration is valid for 10 years these days. Initially, it used to be 5 years. Now it has become 10 years. Then you have to undergo QA, that is quality assurance, for once in 5 years. If there is any breakdown or any repair, then again you have to undergo QA. Also, supposing you want to decommission your equipment, suppose your old X-ray equipment has got spoiled, then you have to again inform LORA system and you have to then decommission. So AERB has to be informed that your X-ray machine has got defunct and you're going to condemn it. So it's a very simple thing. This is a small tabular thing, which flowchart, which is there in AERB website. What do you do first? You apply for your institute registration. You decide, is your equipment manufactured in India? Is it not manufactured? If it is manufactured, you fill application for registration. If it is not manufactured, first you get a procurement permission and then you fill in application for registration. Registering your institute in AERB, this is their website and various guidelines are given in that. I'm not going to go into details. I think you can go into the website and see that, how you get new procurement permission, etc. Other points which we have to see is you have to look at radiation safety, your performance test, etc. All this is given in their website. And also AERB does not approve of routine dental X-ray examination for age determination. Apart from this, you have the Clinical Establishment Act, which is not valid for every state. Certain states are practicing this, certain states are not. So we will quickly go through what it is. This is basically an act which provides for registration and regulation of clinical establishments. So which is not in the purview of clinical establishment, armed forces, medical colleges, etc. are not in the purview. And those categories of establishments which are under state laws, like for example, Andhra Pradesh has got its own laws. So you people don't have to apply for Clinical Establishment Act. It does not apply for the entire country, only for certain states and union territories. It is valid. So if it is not applicable for your state, you don't have to register under it. Who is responsible? The person who owns the clinic has to register himself under Clinical Establishment Act. Who is the registering authority? This is the district registering authority. Your district will register you for Clinical Establishment Act. And what are the conditions? They have got various conditions about what your facility should have, minimum standards, minimum requirements, how you should maintain your records, how you should display your fees, etc. There is provisional registration and permanent registration. Every clinic first gets a provisional registration, which is given within 10 days of application. And later on, they do an inspection and you get a final registration. Sometimes you have to renew your provisional registration after 1 year. Every year it has to be renewed. And after that, when the state decides what should be the standard, minimum standards they have to follow, then you have to undergo final registration. Is there a penalty? Yes. If you don't register, first time you get a fine for 10,000, second time 50,000, and after that it can even go up to 5 lakhs. Then we have other laws like labor laws. This is mainly for establishments which have more than 13 or 15 people. But you have to know what are the minimum wages which you have to give your people in your clinic. So you need to go to Labor Department website. This is example of Andhra Pradesh, where they'll give you proper, amount of minimum wages which have to be paid to your employees. There are many other laws, but these all are applicable for hospitals. So I'm not going to go into details of those, like Pharmacy Act, Spirit License, License for Explosive Gases, Diesel License, Ambulance Permit, Lift License, etc. And of course, state-specific laws, like your Andhra Pradesh CEA. Then, for example, you have YSR Arogya Shri in Andhra Pradesh, where they have their specifications that you have to have 3 chairs, building plan approval, etc., manpower requirement, space requirement. You have to go through all that while applying for it. Apart from these, there are 2 new laws which are coming up. One is National Digital Health Blueprint, where they're trying to merge the domains of healthcare and technology. And they have various building blocks where they're trying to interconnect infrastructure, data, technology, application building blocks, access and delivery. So we will have to, we'll have the responsibility to store all our data in their lockers with the consent of the patients. Every time we have to do it. So this is a very long topic. I'm not going to go into this in detail. Just want to say there is a new law in the pipeline. One is that for that. And the second one is about medical devices amendment rule. in which all our implants, dental implants, maxillofacial implants, orthodontic implants, all those come under newly notified medical devices and they're regarded as drugs. So you have to be given stickers by the manufacturer like you're given for implants. Even for oral surgery implants, orthodontic implants, all those things you have to maintain stickers. This is the trainings which you have to conduct in your practice: BLS, medical emergencies, infection control, BMW, fire training, etc. So here I've just summarized all the things which I said. You need to see your DCI laws, ownership documents, registration with your district authority, registration with Shop Establishment Act, Electricity Board laws, fire laws, Pollution Control Board, Biomedical Waste, AERB, Clinical Establishment Act. Apart from that, you have other acts, other things, laws like income tax, license for ambulance, labor laws, narcotics, etc. And new laws which are coming up is National Digital Health Blueprint and Medical Devices Amendment Rule 2020. With this, I would like you to thank me. I think I have already also exceeded my time limit by 5 minutes. I apologize for that. And I would also like to invite my distinguished colleague, Dr. Kumar Rajan, to take over from here and continue this session for us. I will be taking questions regarding legal requirements at the end of the session. So if any of you have questions, you can just note it down and you can ask me at the end of the session. Thank you so much, and thanks for a patient hearing.
Thank you, Charu, for that wonderful presentation. I hope I am audible, please. Am I audible, please?
Yes, sir. Yes, sir. You're audible. Sir.
Okay. And okay, fine. I would like to share my screen. Kindly give me the permission.
Okay, sir.
You can share it now, sir.
You can share it.
Is it on full screen mode, please?
No, sir, it is not yet full screen, sir.
Can you please confirm now? Hello?
Yes, sir.
Yes, sir,
Is
it is on
is it-
screen.
Okay, thank you so much. Thank you, Dr. Charu, for that wonderful presentation. And I would like to begin by saying that it has been an honor to be with this forum today. And I would like to thank the Lakshmipuram branch as well as ICD International College of Dentists, Dr. Chug, for providing this opportunity to comment on this platform, and as well as go with the presentation, which is things you cannot miss before starting dental practice. So after Charu has spoken already about all the legalities, now I would be taking you to one of the areas which I feel it is my passion, and that is clinical design and safety part. I would start with the disclaimer that I'm presenting this work of presentation, which is with my own professional experience and capacity, and after conducting suitable desk review. A few products which I have shown in this presentation is that I have used and are only for the purpose of explanation and not meant to influence the decision of oral health professionals in any way while purchasing those products. And this presentation is for the purpose of scientific webinar. As much as possible, I have tried to take care to acknowledge the source of presentation. And these views and opinions expressed are of my own, and they are not representing an institution or organization. Now, once you have all the things which Dr. Charu spoke just a while ago, the major challenge sorry, hello? Hello? Okay.
Yes, go ahead.
I
Continue,
thought
sir.
Dr. Hari Krishna wanted to say something. Sorry. So, as regards to the place selection, many of the time I have, this question from the dental surgeons, but dental surgeons, as well as, people who are wanting to choose another practice where they go and settle their practice. So I would request that please choose a developing periphery wherein you can grow with the society. When you grow with them, they feel a kind of attachment with you, and that is something which is very, very, comforting for them, that okay, this dental surgeon has been part of our growing up, our area for so long. And avoid areas you may be successful definitely at one point of time, but then you may take more time to that level. That's why it's very, very important that you try to have one thing I do not do very well visible, so that is something which I paid, and it's a heavy price which I paid. And avoiding like narrow, because you will have parking facility problems, and sometimes your neighbors can have issues related, but you want to be a good neighbor rather than disturbing them. So whenever you are choosing, try to choose a corner plot. If somebody asks me what is a bit better option, while you have the money, if you have the money, you can go for a commercial space, but in case you don't have, my suggestion will be to go for a residential area, because the expenditure goes way down, and there you can have a larger plot size or a larger area, surface area, wherein you can floor area ratio where you can practice, and make sure that it is connected properly with the main roads of that city. Or for example, in metro cities, if you have got metro railway coming up there, it will be a great thing. So these things always help you, and place selection is very, very important. Now, coming to the resource generation, there could be personal saving, whatever you have, and there could be loan from bank. Rather, your personal savings can be a guarantee from the loan, for the bank loan also. Then you can take loan from our parent, who have always been supportive for us, and I think we owe a great deal to our parents. We are here because of them. Then pooling resources, if you are 3 or 4 friends are wanting to join together and then pool up their resources, that can also be a great initiative. Then you have partnerships. Then you can have a option wherein you hire or hire a clinic or take it on lease. For example, if a senior colleague is wanting to hire his or her clinic, or they're wanting to put it on lease, you have the option of taking it on lease, on a long-term lease, and that way it's a win-win situation for all. Then you can have also the option of collaborating with existing chains, and so these are the way you can generate the resources, right? Regarding the various rules and regulations, you have already been enlightened by Dr. Charu, but it's very, very important that you should be aware about those laws, because unless and until you are aware about them, you would not like to put them into perspective while designing a clinic. That's also a very important aspect. So when you design a clinic, the clinic should be for whom? Let's try to understand. When we design a clinic, the clinic should be for me as a doctor. It should be for the staff who are going to work. It's going to be for the patient and attendant who are going to visit our practice. And then, for example, in times to come, when you want to grow your practice, it could be that you want to get the accreditation done for your clinic. It should be also designed for the perspectives of an assessor. So everything should then, if you start thinking in those terms, your clinic design will be good from the beginning itself. We also need to think about the growing elderly population in our country. Now, I'm showing you a result of 2030. And if you can see, people above 60, they are going to constitute 12.4% of our population. And that's going to be around 18 crores. So it's a huge population which we have to cater to. Imagine, even if we are right now 200,000 dentists practicing and 18 crore of elderly patients are there, it's a huge patient load with us. So, and we need to design our clinic accordingly, because the problems related to elderly are many. Like, for example, when they come to practice, they would want to use your washroom. A few, if they are diabetic, they would want to go more often. Then they will walk very slowly, so you need to have the floors which are accordingly made so that they don't slip. You should have ramp. So many things are there which can be required for elderly needs, and accordingly you need to be sensitive with their needs as well. These days I see many advertisements coming wherein the societies where you live are of they are designed as per the elderly needs. Now, the clinic should be designed around you. This is what I say, day, D-A-Y, day, designed around you. Now, if you see, this on your screens, you would be seeing that this particular chair is diagonally placed. So what's the advantage of placing a chair diagonally? The advantage is that you get maximum length. We have read in our oral health medicine or dentistry days that we need to have 2 feet of distance after the head side, and then the leg side, and then all the other sides also 2 feet each. So that makes it, if the chair is totally in supine position, it becomes 6 feet, and then 4 feet, 10 feet, and then 4 feet width and 4 feet more. Minimum space is 80 square foot. So if you use the diagonal area of your clinic, it becomes much usable. And please make sure that all the things which you have, as you can see, the yellow band which you can see on your screen, the semicircular one, try to keep everything in this area, so that the dental assistant who is standing over here, or you are standing here, whether you are working sitting or standing, or in 12 o'clock position or 10 o'clock position, everything should be there in your reach as well as your dental assistant's reach. So for example, if you keep things over here, if you make your cabinets here, or you make your cabinets here, each time the dental assistant will have to go here, bring the stuff, go back there. So it makes more sense that to avoid time loss, you keep your belongings on the head side of the chair. So that is one request which I have to make. Then it is also important to position of yourself very well. When you try to make your clinic, many people are adapted to working 12 o'clock position. Many dental surgeons are wanting to work in 10 o'clock position. So you need to be very, very clear as to where you would like to keep your stool, and I'll come to the following slides, and where your dental assistant would be, and that makes it easier. Now, how big your tray is going to be, how you are going to place, for example, are you going to be keeping things which are used frequently over here? No, because then there will be issues related to keeping them and taking out, maybe it will fall. So you need to be using things which are used more frequently and keeping here, and then things no longer needed in this area. So you need to design it accordingly. You need to, and whatever may be your budget, whether your clinic requires 10 lakh of investment or much beyond to a crore, try making it as appealing as possible in your kind of budget. The budget could be anything, but try to make it more appealing, so that when the patient come, they feel welcoming, and of course your staff as well. So to make a good clinic, you need to invest in some groundwork also. And anything, I mean, say even the tallest building, Burj Khalifa, had some groundwork before it was built. It was not built in a day. So you need to have your groundwork in place. And let's start with doing something as a rough sketch. For example, you are sitting, you are trying to understand what are your needs. And let's see, for example, here I have made a rough sketch on PowerPoint for 2 operatories, for example, which is 9 feet by 10 feet. 9 feet by 10 feet, I have taken very, ideally it should be 12 by 12, but I have taken it 9 feet by 10 only. But then please understand that what are the rooms which are required. For example, if you you see this line, you will feel that you'll see on your screen that this is greener, and then it goes on reducing, its white, which means that the movement of people in this facility. So more people are moving in this area, more people will move in this area, and then lesser and lesser number of people will move in this area. So that's why it's very, very important that when you design your clinic, your reception, you should have place for reception and records. You should have a waiting room. Then you should have a radiology room in case you wish to go for OPG, or otherwise this can be removed. You need to have wash and changing room, definitely. You need to have your own consultation room, and there need not be too many consultation rooms. All the people can utilize the same consultation room depending upon when their patients are on appointment. Then there has to be a staff room, small staff room, where they can sit, have dinner, have lunch, or otherwise. Then dental material storage room, that's very, very important, because many a times we keep dental materials in areas which are more in humidity and temperature, and then we lose the properties. Then we need to have a disinfection and sterilization room. Then finally comes dental operatory. But most of the time we try to club everything in dental operatory, which becomes a problem later because of the space constraint. And similarly, as you can see, there is a space for suction and compressor area, and then plaster room. So just draw a rough diagram, and then after you have drawn a rough diagram, try to take help of a person who is qualified into space management, and that's your architect. Don't shy away from giving the professional fee to an architect to design, because we may be good in designing, we may be good in everything, but sometimes we are not able to see the way they are, the architects see, and then they bring out the space which you say, oh, from where did it come? I was not knowing about it. So that's something which you need to take care of. Ramp for patients is very, very important. As you can see, you can have a ramp which is made permanently to take the wheelchairs in the clinic, or you can have, for example, the makeshift one which can take the wheelchair. And this is very, very important, because as I showed you earlier also, the number of elderly are growing, and then there would be patients who are non-ambulatory who would like to take the facility of your clinic, avail the facilities of your clinic, so that way you can help them if you have got a ramp. Coming back to the designing of the chair, so for example, you need to think about, okay, this is going to be my chair design. I have chosen this make, for example, and then whenever you are buying a chair, don't shy away from asking the dealer as to give you a cutout, a cutout like this, as you can see, real length cutout, both in width as well as length, in supine position, so that you can keep that cutout wherever you wish to design. For example, here I have kept it in a diagonal manner, and now everything will then will be fixed around this. You keep your chair here, you keep your stool here, and then you keep your chair position here, and then design things around you. So that way you will be benefited, and it will hardly cost the dealer, say, for example, 600 to 1000 bucks, and but this will help you a lot in designing. Now let's see what it does. So now you have this chair in place, the design is there. Now you need to start thinking about the plumbing lines, where it will go, from where it will come. So now if you have this cutout there, you can design your plumbing lines as well as suction lines, and that will help you a lot in kind of taking care of the needs at a later point of time. If you can see now that I have this in place, I would like to make this design, and always go for this kind of design, because all things can be fitted here. So that's why it's very, very important that when you are designing, take into consideration the thoughts of the mason, the plumber, electrician, carpenter, and of course the product specialist. And a proper plan is a must. Now you would see that in this trench, you need to be fitting all those plumbing lines, and there has to be a gradient, wherever your chair is there and wherever the drainage is going to go, there has to be a gradient. The place where the chair is there, it should be at a higher level, and try maintaining at least a gradient of an inch or more, because then the flow will be good. Nothing will get stuck in your pipelines. That's very, very important. And then, as you can see, the pipelines for following are must when you are doing this. In that gradient which I showed you just now, in this only these things have been placed. There is a suction drainage line, then air compression line, then electrical line, then HDMI cable if you want to show the television or the television screen right in front, or the monitor right in front of the patient, then you need to have the HDMI cable line, then the water line. And water line would have for the booster bottle, tumbler, spittoon, everything has to be taken into consideration. So now see, I started with this, and now we have reached this stage because of a simple thing, which is the cutout. Now, plumbing line and drainage and suction, it's very, very important. And it's very important that you take air from outside, and this is the suction machine, as you can see. And suction machine operates on the principle of, the air kind of, it sucks the air from this area and throws it out, right? So when you have the water as well as air in your suction line, that is the low volume suction or the high volume suction, it will be taken going through this pipeline. It will go into the drainage. This will go into the drainage, that is the water, and then the air will be escaped. Many times I see that people are keeping suction apparatus in their operatory. Please make sure that if you are keeping suction in your operatory, the exhaust valves are checked regularly, because the air which will be kind of having the issues related to aerosol or infection, it will come back to the operatory again. So make sure that the vent goes outside, and that will help you a lot. As regards to flooring, it's very, very important that you should have as much as possible crease free. Now again, this is my clinic, and then this is something which I did wrong. I never had the understanding. You should not have crease, because if you have joints, if you have crease, then whatever work you do here, the aerosol kind of keeps on depositing here, and later it becomes difficult for cleaning. So have it as jointless as possible. It will help you, because the cleaning and the disinfection part, hygiene maintenance, it becomes very, very easy. So now, for example, if you see this, there is no joint, no crease. So that makes it very, very simpler for your staff. When you are designing your clinic, please make sure that you have more number of electrical sockets than you require. If you have more number of electrical sockets, you can use many of the electrical equipments later, which you have not envisaged, and when you grow, when you are going to put in your clinic. So this will help you, and try to have the MCV over here itself, so that if there is any problem, even when you are having, I'll come to the voltage regulator, but otherwise you are going to be having the MCVs, and they are going to save your equipment, which are so much costly. Now look at this space. Now this space I designed because this area was to fit these two trolleys. So if you see, there is not almost a 1 inch of gap here, 1 inch of gap here, and it goes in inside. And the metal trolleys are always beneficial, because it is very, very easy to clean. You will not have the problems of rodents, or it will not have anything which can kind of give way. You can always get it repaired. So my suggestion is, on almost cost will be the same. If you try to have the costing of the carpenter work plus the material plus everything, it comes out to be the same. So when you are designing your clinic, it is very, very important that you keep into consideration these small things. Now, when you are having the glass, as you can see, the window glass, it should be tempered. If you have got a large window, please make your glass tempered, because on one fine day, if there is an issue, this glass is not going to cause any trauma or any injury to any of your staff. And try to have enough sunlight as possible. If there is a space, try to have enough sunlight. Design your cabinet space, as I said beforehand, and electrical fittings. You need to think about it. And as Charu was mentioning, that for example, in Uttar Pradesh, where we have our practice, there, if your clinic is more than 540 square foot, you need to kind of go for the commercial meters. If you go for commercial meters, then in that case, each and every will count. They will count accordingly. So you need to be very, very careful on these things. Okay, because then only you can decide the kilowattage of your. Preferably, nothing should be there, nothing should be visible in front of the patient except for the TV monitor, wash basin, or poster on hand hygiene. It should look neat, clutter-free. For example, here, if you see the patient is showing with his finger that I'm wearing a denture here. Now, if there is a screen in front of the patient, and that's where I told you that the line of HDMI cable has to go. So it's very, very important. The patient is very happy explaining to you, because then he or she can tell you that what's the problem is, or when they are seeing everything in front of them. So that will help you, and that will enhance the practice level also. Coming to, as you can see, one of my colleague, he is sitting here and watching whatever is there is going inside, whatever is being done inside his mouth. So it gives a sense of good feeling to the patient. And also try not to have light. You know, I see many times when I visit practices, the lights are coming directly on your eyes. You know, our dental chair lights are very strong, and above than that, if you have more number of lights coming and kind of hitting the eyes of the patient, it becomes very difficult. So try to be having those lights which are in different areas, which is not directly coming on the eyes. Basin, when you choose the basin, try to have the basin which is joint free, because you will find otherwise that you know, it will get dirty very often if they are having this gradient, or otherwise it becomes very, very easy to for anybody to clean it. And as you can see, this liver mixture also helps you, because you can just use your elbow and wash. So these things are available already, and you can purchase them whenever you wish. So try to invest smartly. Coming to CBCT and OPG, legal requirements, Charu has already spoken about. But when you start making it, what are the things which you do? For example, when you are at the brick stage level, and this is going to be 10 inches, you know, you need to fix these chalk huts or these areas beforehand, and then on them try to put the lead sheet, because most of the time the you know, the assessors, when they are going to come, they are going to ask you that how are you shielding these areas of wood. So please tell them that these areas of the wood are already having lead sheet on them, 2 mm of lead sheet. Similarly, the door also would have a lead sheet on them. And then, you know, this is the same thing. The brickwork which you see is now taking shape. Now it has been properly, this is the chalk hut, or the area surrounding the lead glass. As you can see, there is one more lead glass here, and all of them are lead coated over here on the doors and everywhere. So that way you can always answer the questions. And if you can see, till the height of 7 feet, this area also is having a lead sheet of 2 mm. And finally, so this is what you do when you design CBCT and OPG. And of course, when you have this design, try to have the caution X-rays signages also placed. For example, this is our CBCT machine, and pregnant, for there has to be a notice for the pregnant patients, and the caution as regards to the X-ray radiation, that has to be there so that patients can see it and take suitable action. So now that we have designed, now we have kind of given you a rough idea as to how to design a clinic. Then comes the issue of the infection control. You know, the COVID pandemic has come now, but see this newspaper, this is of 2014. At that time, in this Times of India, New Delhi, Noida, Ghaziabad edition, we had this dental clinics are hotbeds of infection. So infection is not new to us. We were, you know, anyhow fighting with HIV, hepatitis B, C, other tuberculosis, and so on and so forth. So it's very, very important that we minimize. And when we minimize the risk, we put in the factors while we are making the clinic itself. So that way it helps. In the COVID time, we had this thing, and you would have received this on your WhatsApp also. Healthcare workers are at greatest risk. Then the occupations with the highest COVID-19 risk. Then again, dentists, dental hygienists, and dental assistants were coming right in front, as you can see. But I'm sure with the way we have taken care of ourselves, we have taken good precautionary measures, infection prevention control measures, we have worn in PPE in a good manner, then we have been able to save many issues which could have been, otherwise differently there for the whole country and for the whole world. But thankfully, God has been kind on us, and we have also used our brains. Consideration for the provision of essential oral health services was given on 3rd of August by the World Health Organization. If you see this sitting arrangement in a naturally ventilated room, you will feel that, for example, this is the worst kind of setup, because you are sitting here and the patient and attendants are sitting here. If the air is flowing from here, it is going towards you, right? So if you now place your chair here and the desk is here, now if there is a cross ventilation, you are at least, escaping some part of it. So that's a good or a better. So I would request you all to go through this guideline, which all the presentations I have mentioned the sources throughout. So please go through them, and you will be benefited. Coming to the your own voltage stabilizer or power backup. Today is the day of renewable energy. So if you have the facility, you can have your own voltage stabilizer and power backup in terms of solar panels. But in case you don't have the facility, you must have some voltage regulator, because otherwise our equipments are so costly. A small amount of fluctuation and then everything goes haywire, and there's a huge cost. So if possible, try to count your kV, kilo voltage, and accordingly then try to have a servocon or whatever you wish to buy as per that requirement. Then you need to have generator also as a backup, because sometimes if there is a issue and the UPS cannot take load for more than 20 minutes, then it becomes a difficulty. So you should have your own generator. There are issues with diesel generator. For example, many a times during the pollution period, peak pollution period, in Delhi NCR, the diesel gensets are banned. So in that case, it will make sense if you have got a petrol generator, which is kind of 7 kV or so. It will be able to take care of at least your necessities. So you should have that planned as well. And I've already spoken about the solar panels. Coming to the engineering controls, because they are very, very important, and engineering controls, help you attain the level of safety. If you see the hierarchy of the controls, basically, if you are eliminating an hazard, that's the most effective thing. But if you can't eliminate or substitute the hazard, then you need to be banking upon engineering controls. And then if at all it's a self-explanatory diagram, so you can go through it. But otherwise, as much as possible, try to eliminate the hazard. If not, try to use engineering controls. Now, engineering controls, they protect the staff by removing hazards condition or by placing a barrier between the staff and the hazard. And well-designed engineering controls can be effective for protecting the patient, staff, as well as the attendants alike. There is a CDC, Center for Disease Control Guideline, Interim Infection Prevention Control Guideline for dental settings during the COVID-19 response, and that was updated last on December 04, 2020. They have recommended that we need to consider the use of portable HEPA air filtration unit while the patient is undergoing and immediately following an aerosol generating process. So many times the questions are asked regarding the HEPA filter. So the HEPA filter, please try to select which is based on clean air delivery rate, that is called as CADR. Sometimes the seller will try to convince you that it is for this, this much square footage. No, don't go for that, but go for clean area delivery rate. What is its CADR per minute or per hour? So that way it is going to be beneficial, because higher the CADR, the faster the air will be clean, and then it will be removal of aerosols also can be undertaken. So this is something which has been already clarified by CDC. You can visit this site and gain more insight. I'll try to give you a pictorial representation of the same. Let's see, this is the dental chair where I'm working. Now the split AC or the window AC or the wall fan or window is on this side of mine, which is the head side. And then, for example, this is the exhaust, right? And this side is the exhaust. And then the airflow should be from my side to the exhaust side. And you can keep the air purifier in between. You cannot keep the air purifier over here or in between the patient and myself or the assistant, because then you will be harming. So there has to be a definite way in which these things need to be kept. These are called as small engineering controls. And the dental room air changes per hour, as you can see, it's already mentioned here for various areas, and the link also has been prescribed as to from where you can get these details. There is also our own national guideline, Ministry of Health and Family Welfare, Government of India, wherein you can have these air changes, as you can see, per hour, registration areas, outpatient departments and waiting areas, inpatient departments, everything is mentioned there, so you can use accordingly. Coming to the air purification system, Henry Schein, which deals into dental products, they have given a very good matrix, and I would request you, if time permitting, just for fun sake, if you go there, this is a air purification system decision criteria matrix, wherein you can go through and depending upon what is available in your country, you can take a informed decision as to which one you would like to go for. But essentially, all the air purifiers, they work on the same principle. Input, there could be viruses, bacteria, blood pathogens, odors, aerosols, these are inputs, because they have to go through these things, and then finally ultimately we are concerned about the output, which should be the clean, purest, and re-energized air. So you can take help of them. Now, there was a clinical study measuring dental aerosol with and without a high volume extraction device, which was in British Dental Journal, and I would encourage you to visit this literature, and it's very, very good. They have clearly mentioned that it is of help, and high volume suctions, they play a major role. And as you can see, this unit contains three pipes. This is the low volume saliva ejector. This is the high volume for aerosol, and then this is a kind of high volume for spit or rinsing also. Sometimes, for example, elderly patients or non-ambulatory patients, they can't go to, or a pregnant lady, they can't go to the spittoon again and again. So this helps a lot. You can bring it here, your assistant can bring it here, or the patient can hold himself or herself and then spit in this spittoon. So this again is high volume. So you need to put these engineering controls in place when you are designing your clinic, and then it will save you lots of money, because later if you wish to do these things, these changes, it becomes a problem. There are already enough infection prevention control guidelines from Center for Disease Control and Prevention. And of course, the summary of infection prevention practices in dental settings is also released. So you can go through them and make your clinic much better in terms of infection prevention. WHO has already, have this poster which you can, put in your clinic. It says that your five moments of hand hygiene are before touching the patient, before clean aseptic procedure, then after body fluid exposure risk, after touching patient, and after touching patient surroundings. So these are, you can display these, posters in your clinic. It reassures the patient a lot. Coming to the hand wash and hand rub, these are the posters which you can place at appropriate places in your clinic, wherein staff can see them daily and try to imbibe what is written there. And always try to have a periodic check. Ask your staff to show how they are cleaning, how they are hand washing, how they are hand rubbing, and that becomes a fun activity also. Sometimes you all can do together, and a video can be made. It is very reassuring to the patient. Ministry of Health and Family Welfare had already given guidelines during the COVID time, and it has been kind of coming again and again as regards to what has to be done, how you should be, using the dental operatories, what are the rational use of personal protective equipments, and how you should be doing it, how should be using it. But please remember that when you are using the personal protective equipment, the donning and doffing, removing them and wearing them is also equally important. You cannot touch the outer surface and then touch the face, or so that's very, very important, and you should try to have that in practice, wherein you are wearing it correctively and disposing it correctively as well. Now, there has been many guidance from WHO also. The date wise, I have mentioned them. You can go through at your leisure. Coming to the biomedical waste management, which Dr. Charu has already spoken about. Now, this is something which I would request you, this particular poster, try to keep in your clinic, so that your staff knows what goes into yellow, what goes into red. You can have pictorial presentation also, what goes into white and blue, and try to, do this training once a while in a week or a fortnight, and try to assess the understanding of the staff. Now, these are the symbols which needs to be present on the bins. As you can see, there are different types of bin which you can have. Please make sure that the bags which you are using are non-chlorinated one. Then there are areas wherein patients have, wherein the assessors have asked, or the people who are coming from Central Pollution Control Board, they have asked how you dispose your water and infected water. So then today there are these things also available, and then you can treat in these machines and then try to put it into the drainage water line. So biomedical waste management is very, very important, and please make sure that whenever you are buying, many times I see that a normal normal dustbin of different color is bought, which is open, and people are using that as the biomedical waste management bins. That is wrong. It should always be covered. It should always preferably have the pedal, because if you press on the pedal, this lid opens up, and you are then putting the right waste at the right place. The guidelines are already available on the Central Pollution Control Board. If you go, what are the things which you can put in the red bin, yellow bin, and this is a beautiful, pictorial guideline which you can go through on that site, and you can distribute it among all the Indian Dental Association members who are listening to me as of now. You can have this downloaded, and you can help your fellow colleagues, have this. And also, I'm told that through DCI also we have got a manual on biomedical waste management in dental clinics, which you can see it's here. This is the book, so you can go through them as well. Coming to the disinfection and sterilization part, these are the 5 things which you need to remember. And if you know what, how, what with, when, and who, your disinfection and sterilization will always be good. What with, how has it been done, what with it has been done, what is to be cleaned, when it is to be cleaned, when it is to be disinfected, when it's to be sterilized, who is doing the disinfection, who is doing the sterilization. If you know this, you will always have a great control on the disinfection and sterilization, as well as infection control at large. So coming to disinfection and sterilization, if possible, please have a sterilization zone in your practice, wherein you can clean everything properly. And the first part is that the surface has to be thoroughly cleaned, and cleaning of used instrument with disinfectant, and then thorough cleaning of instrument by manual or ultrasonic rust inhibitors, and then high quality disinfection of instruments and washing in running water, then drying, pouching, and sealing. And then comes the heat sterilization using steam under pressure, that is, for example, your autoclaves. I found this particular device or holding instrument, I would say, very useful, because after you have worked on the patient, and during when you are carrying it in your hand, or your staff is carrying from one area to another area, it is closed, nothing falls off, and there is a disinfectant inside. So once you have used it, you can keep the instruments into this, and then it helps a lot, because by then it is already closed, it is inside this, and disinfection is taking place. Coming to the various notifications which has come up lately, as you would appreciate, times are changing. By God's grace and by our own wisdom, if we are able to use good COVID-19 appropriate behavior, as well as the etiquette is used in a community friendly manner, and we are using the guidelines which are issued from time to time. For example, this is one of the guidelines issued very recently on 29/9/2021 by MOHFW. We are definitely going to survive this, and it's going to be, the good times are going to be back again. Finally, coming to few more slides regarding the interim infection prevention control recommendation, which has been updated on 10th September 2021 at CDC. If you go there, whenever possible, dental treatment should be provided in individual rooms. Many times I have this question, and please see, if at all you have been able to make your clinic design since beginning in individual partitioned room, it is going to help you a lot. But for example, if you have got dental clinics facilities which are with open floor plans, then these things should be taken care of. At least 6 feet of space between patient chairs or more. I would prefer more because, for example, when you take X-ray, and these days handheld X-ray systems are getting commoner. So many times, you are shooting the X-ray on one patient, it's going to the other patient. So these things should not be done. Try to have individual rooms as possible when designing the clinic. There has to be physical barriers otherwise between patient chairs, and easy to clean floor to ceiling barriers if possible. For example, if it is a tiled thing, then you can clean it very, very nicely in individual rooms. And operators should be oriented parallel to the direction of airflow. As I have already mentioned through pictorial diagrams, try to do that. A total of 17 guidance documents from 16 countries produced between this time period was produced on the Cochrane review, and you can go through the site and all the recommendations, and which is evolving again and it is going to be beneficial if you want to know more on this. Here are a few of the references which I would request you to kindly go through, which are mentioned, and you will find them helpful. Thanks a lot for your patient listening, and I wish you all a very, very safe period ahead. Thank you so much. Over from my side.
I request Govind sir to speak a word about the presentation. Principal of DSL Dental College.
I want to thank, first of all, to Dr. Rajiv sir and Charan sir. I want to thank Rajiv sir, Charan sir, and Kumar Rajan sir, Charubala madam, and Hari for doing this excellent program. Thank you very much, sir. And this is really a motivation for all of us, and particularly the young budding dentists who want to start the practice. What are the roles they need to play? And madam, the legal aspects as excellently she has elaborated. Thank you very much for your valuable time, Charu madam and Kumar Rajan sir. And Rajiv sir, really hats off for you for organizing such a great speakers for this event, and all the budding dentists across the country are really enjoying the main essence for the starting dental clinic, what the precautions they should take. And Hari and the team, thank you very much for your valuable contributions for time and everything. It is a Sunday. Now I request it is for Hari Krishna to take over and ask for the questions, if anything, for the audience. Thank you very much.
Okay, sir. Thank you, sir. Sir, this is a very interesting and thought-provoking presentation for each and everyone who have given their valuable feedback in the messages. So I have few questions for Charubala madam regarding clinical hospital. Like you have mentioned some NABH criteria for a clinic and hospital. Whether a NABH is for a clinic or a hospital-oriented standards we need to follow.
So it is like this. NABH stands for National Accreditation Board of Hospitals and Healthcare Centers. So they have standards for both hospitals as well as dental clinics. Dental clinics are assessed with the same 10 chapters, but with smaller number of objective elements. That is, you need to have infection control, for example, in a clinic, as well as you will need it in a hospital. But the scale of operation will be different in a clinic as with a hospital. So they have different objective elements, that is different ways in which they will judge your clinic as compared to what they will do to the hospital. So it is applicable for everything. You want to get your clinic assessed, you can do that. You want to get your hospital assessed, you can do that as well.
Okay, madam. Like one more thing, they have asked about insurance plans and government reforms regarding dental treatments. There are any facilities available for the
for the insurance sector? Dental is at a very, very what can you say? We are taking baby footsteps. There are certain insurance companies which offer dental plans as well. And the thing is that we have an authority called IRDAI, that is Insurance Regulatory Authority. So they have, for bigger hospitals, they have mandated that you have to have NABH compulsorily at an entry level stage. That means if you want your hospital to avail of insurance so that the patients who get insurance get treated at your hospital. You need to have basic quality standards which are prescribed by NABH at an entry level. But as far as dental is concerned, we don't have that as yet for dentistry. Like I said, we are at a very, very early and nascent stage. We are taking baby steps, but still there are a few insurance companies which are providing dental cover, but you don't require entry level NABH as of now for dentistry.
One more question, madam. Regarding you have told the advertisement related question, like whether they can keep. So one more they have asked, like government empaneled, like Arogyasri or whatever it may be, they are empaneled. So they can advertise based on that to the hospitals, like in the scenario.
So if you are
It is
empaneled
legal.
in YSR Arogyasri, or if you are empaneled
Yeah.
in CGHS or in ECHS,
Yeah.
then you
Yeah.
can definitely mention it on your website. Or if you get newly empaneled by Arogyasri, you can definitely, because it's a new addition of facility to your clinic. So you can definitely advertise at that time. But again, it has to be done in an ethical way. You can't have it on an auto rickshaw or a bus. Please note.
Okay.
I would like to add here,
Yes.
you know, the website is a must now, because if you go through the Central Pollution Control Guidelines, you will find there that each and every year in which you have generated waste, you need to put your reporting and upload on your websites as well, if you are generating biomedical waste. So try to make the website as engaging as possible, and people will kind of hook up to you. And as absolutely said by Charu, it has to be ethical, and you know what you are going to put there. Thank you.
Thank you, madam. Apart from that, most of the questions are similar way, asking related to the dentist reforms, insurance, and or NABH. So they are asking, is there anything we need to train regarding NABH dentists, like to set up a practice? Is there any protocol to be followed to set up related to NABH?
Yeah, so actually, Dr. Rajan raised a very important point. When you start designing your clinic, that is the first time you have to consider how to implement NABH standards in your clinic. Because it starts from the designing. If you have not kept space for infection control as a separate room, then it is very difficult to follow the standard. If you don't have a separate place for storing your dental materials, then you will not be able to follow the standards. Basically, NABH has got 10 chapters for which they have implementation programs which are conducted by NABH. If anybody is interested in attending that, you can have a look at NABH website. Whenever the implementation program is held, you can apply for it, and you can participate in that. So you'll get an idea of what NABH standards are. Then you get a better idea of how to implement it in your clinic. But the purview of our talk today was not related to that. We have given a very basic understanding of what legal requirements and what design aspects are required for your clinic.
No, actually now it's my question, madam, actually related. Like DCA also is making mandatory for a NAC to go for every dental college. So I think NABH also for every dental clinic, it will be mandatory in future, maybe. I'm thinking so.
The government of Telangana has mandated that they have to have NABH in all their dental clinics if they have to get empaneled in their government, this one. Like you have YSR Arogyasri in Andhra Pradesh.
Okay.
So slowly it is going to come in all states. So it is a very good idea that when you are in the planning stage of your clinic, at that point itself, if you understand the requirements which are needed and you plan your clinic accordingly, that is the best thing which can happen. And in fact, if your dental college is interested in conducting some kind of a small program on implementation for your students, you can request NABH Secretariat, and if they are kind enough, they can permit me and Dr. Rajan to come and take a session for you. It's a very long topic. It can't be unfortunately covered in this very short period of time.
Definitely, madam. We will come back to you again regarding NABH, madam. Surely.
Thank you.
Sir, there is a question for Kumar Rajan, sir.
Please.
Regarding, is there any ideal specification for dental clinic setup?
Yes. So, for example, if you there are two aspects to it. As I have told you in my presentation, you may have seen that essentially people feel that if they have got a 10 by 10 room, they are good enough to go for a dental clinic. Please make sure that it is not the case. You require you require only an operatory at least 80 square foot, 10 into 8, as I have told you, because if you are going to put your chair in a supine position, 6 foot is the length of the chair, and then you require 2 feet on the leg side, 2 feet on the head side, at least 2 feet on the assistant side, and 2 feet on your chair side. So that makes it 10 into 8, that is 80 square foot. In my presentation, I showed you a graphic representation of 90 square foot, but that is only for the operatory. Apart from that, you would require something for the consultation. Then you would require for a reception. If you go into the clinical establishment guidelines, you will find that there has to be a requirement. There is a requirement of washroom also. So where are you going to accommodate if you are going to have only 100 square foot? So ideally, if you ask me, one chair practice at least should be around 400 to 500 square foot, because it is for one chair I'm trying to talk to you about.
I just want to make one small point here, Dr. Hari, if you'll permit me.
Yes, sir. Yes, madam.
I would like to mention that although your state doesn't follow Clinical Establishment Act, I would request that all of you go to their website and go through all the requirements which are needed for dental clinics. That will give a very good idea on what are the basic requirements which are mandated by the government, because this is followed in many states. So it will give an idea of how much space requirement is needed, washrooms are needed, like doctor said, waiting area, how big it should be. And those are the very basic requirements. And actually you should expand on that, but it should definitely not be smaller than that. So for that, please go to cea.gov.in. Clinical Establishment Act has got its own website. You can go into that and have a look at what is required.
Sir, okay, madam. Thank you, madam. One more question, sir. Like nowadays, practice, they have asked like a little bit confusing. The question is, the practice is need to be shifted to rural areas because more dental clinics are there in cities and towns. So, is there any like need for a budding dentist to start their practice in rural areas than urban cities or whatever? They are asking in the terms, I think so.
Okay, is this question directed to me?
Yes, sir. You only, sir.
Okay, fine.
Getting
So in my in my presentation, I mentioned very clearly that even if, for example, if I would have passed today from your dental college, then in that case, I would have chosen an area where I could grow with the community, right? If the community is growing around me, I would have liked to grow with them. It is not at all, required that you go and open up a clinic in rural areas only. Wherever you can, your finances can allow you, support you, as well as where you feel that there is an opportunity wherein you can grow with the community. Please choose those areas for your own, financial benefits as well as lesser infrastructure cost.
Okay, sir. One more thing, sir. Like they're asking where to set up the practice, whether it is near commercial areas or we can set it in a residential area. They're asking, sir, one question. Which
Okay,
is
again,
more preferable in
I
present
think
scenario?
I think I answered that also in my presentation. And I made it very clear that, for example, I always try to put myself in the shoes of a young dentist who is coming out of the college. If I would have had that liberty to open my clinic today, I would have chosen a developing residential area, point one, connected to road facility, point number two. I would have chosen a third point is a corner plot where I would not have had the problem of parking facility, and that would have given me that premises would have been available to me at a much lesser rate than a comparable commercial area.
Sir, last question, sir. No need to bother you much. Related
Please
to
bother
this.
me more. Please bother me more.
I'm like scrutinizing the questions based on that. I'm selecting the which is better to
Thank you
ask
so
you
much.
related.
Thank you so much.
Sir, last question, sir. They are asking, can you provide any like format less than 10 lakhs if they want to set up a practice? So they don't need to go for much more to spend in the initial stages. So they are
Okay.
asking within the 10 lakhs, there is anything we can follow all the setup and practice
Yes.
oriented.
Yes. Yes. For example, if I am the person and there are Dr. Hari is my friend, and then a few more doctors are my friend, and each has 10 lakhs, it becomes 50 lakhs. Now we have, opportunity to buy a better place and make a better practice. But for example, in 10 lakhs also, there are two aspects to it. One is whether the space is there with you. If the space is not there with you, then you have to take it on a rental basis. So my suggestion will be, then out of that 10 lakhs, if that is the total amount available with you, leave 3 lakhs aside and only invest 7 lakhs rupees, because you will also require some money to sustain. You will require at least 3 years to sustain in that area. Only then the patients will start knowing you by name and coming to you. So my suggestion will be that if you are having a fund of 10 lakh value, try to invest 7 lakh and then keep 3 lakhs with you as a fixed deposit so that you can run through. And then 7 lakhs, always try to put more focus on the chair has to be as per the patient. The chair has to be as per the comfort of the patient, right? The suction as well as compressor has to be as per your benefit. You should not, shy away from spending there, because ultimately the suction and the compressor has to be good. It should not, emit aerosols as well as the infected air inside the operator itself. So invest there and try to have equipments which are not, very costly, but at the same time invest wisely in terms of whatever you buy. Because these are the few basic things, and design your clinic in a way that you require lesser inputs as regards to engineering controls. Thank you.
Okay, sir. Thank you, sir. Sir, most of your presentation is of your experience shared. Rajan sir, Kumar Rajan sir. Your own practice and your own clinic, you have shared experiences, which is very, very useful for a budding dentist to follow all those things. Thank you so much, sir. Thank you, madam, for your excellent presentation. You made it easy to read DCA regulations with your presentation.
Thank you
So
so
most
much.
of the
I'd
people
like to
don't-
chip in here.
Yes, sir.
On behalf of the organizing team, first and foremost, I wish to thank Dr. Charubala Pavan and Dr. Kumar Rajan for their excellent, very informative and very interactive presentation. I compliment them for their inputs from related to clinical design, safety, removing all doubts related to ethical practices and consents required by various government authorities. I think you covered all aspects, and I'm sure the participants really enjoyed your presentations. Thank you so much. I'm really grateful to you.
Thank you, sir. Thank you,
The
everybody.
team GSL Dental College also deserves special acclamation for their support in organizing this event and helping us reach out to so many dental professionals all across India. The series was conceptualized by our fellow Dr. Sunil Ghanta, who right now is not keeping good health. We wish him a very speedy recovery.
We pray for
I
him.
am extremely thankful to you, Dr. Govind Raj Kumar, Principal of GSL Dental College, Rajmundri, for taking this initiative of organizing today's program. I am also grateful to Dr. Gani Bhaskar Rao, Chairman GSL Education Institutions, for supporting the webinar series. We are obliged to Master Fellow Dr. Krishna Nayak for constantly guiding us. The organizing team is grateful to him too. Friends, we are very soon going to come back to you with a new webinar on a very new subject, very relevant subject. Till then, enjoy yourself. We wish you all a very happy, healthy, and prosperous Diwali. Thank you. Grateful.
Happy Deepavali.
Happy Deepavali.
Thank
Happy
you.
Diwali, sir.
Happy Diwali.
Thank you,
Thank
sir.
you.
Thank you so much.
Thank
We'll end
you.
this session with
Bye
you,
bye.
sir.
Take
Thank you
care.
so much, sir.
Thank you, sir.
Thank you, sir. Good. Ready.
సార్ ఆపేస్తున్నాను సార్ లైవ్.